Okay, so today we are going to take a deep dive
Mm-hmm.
into something that's um, maybe not the most fun topic,
Right.
but it's something that I think we all need to
Yeah,
be aware of,
for sure.
and that is stomach cancer.
Okay.
And we're going to
Very
talk all
fun.
about the risks, the
Wow.
symptoms, the things that we can watch for and how we can,
Yeah.
I guess, catch this early
Right.
and hopefully have a better outcome.
Yeah, absolutely.
So,
I mean,
I-
you've provided some really interesting information
Sure.
about stomach cancer, and it's really cool to see how much power we actually have
okay.
when it comes to this.
Yeah.
It's not just about fate or genetics. There's a
Right.
lot we can control.
Okay, so let's start with the basics.
Yeah.
What exactly is happening when someone develops stomach cancer?
Right.
Is this like a sudden thing, or is it more of a process over time?
I think a good way to picture this is
Okay.
like a rogue state slowly kind of taking over. You see, stomach cancer starts in the lining of your stomach,
Okay.
often in the innermost layer.
Uh-huh.
If it's not caught early, it can spread to other parts of your digestive system
Oh, wow.
and even to distant organs.
That's scary.
It is, yeah.
That's like a tiny rebellion brewing in our guts.
Yeah, I like that analogy.
So,
Yeah.
if we're playing detective here, let's talk about risk factors.
Sure.
Who is most likely to
Yeah.
face this kind of stomach rebellion?
Well, I think one of the main culprits we always talk about
Oh.
is a bacteria called Helicobacter pylori,
Okay.
or H. pylori for short.
Okay, yeah. I've heard of that.
Yeah, and this little troublemaker, it inflames your stomach lining, which can lead to ulcers.
Oh, okay.
And then if that's left untreated,
Yeah.
it dramatically increases your risk of developing stomach cancer.
Wow. So that's a really
Yeah.
important thing to get
Yes.
checked out
Yeah.
and make sure.
In fact, studies have shown that people who are infected with H. pylori
Okay.
are 6 times more likely to develop stomach cancer.
6 times. Okay. That is,
It's a scary statistic.
yeah, I definitely want to make sure I'm not harboring that bacteria.
Yeah.
So
To test it.
getting tested and treated for H. pylori
And
is
just
like
top of the list.
top of the list.
Yeah.
Okay. So what else should we be thinking about?
Well, age is a big one.
Okay.
It's much more common after 60.
Really?
Yeah, so it's like as your stomach gets older,
Yeah.
the more vulnerable it becomes.
So it's almost like your stomach's warranty is starting to expire.
Uh-huh, yeah, in a way.
Oh, no. So,
Family history is another one.
okay.
So if a close relative has had stomach cancer,
Mhm.
your risk goes up.
Okay.
It suggests there could be a genetic predisposition.
Okay. So genetics,
Uh-huh,
age,
Yeah.
bacteria.
got it. Those are the big ones.
What about lifestyle?
Lifestyle.
Does that play into this whole
So,
saga?
what you eat can make a big difference.
Really?
Yeah.
Okay.
So diets high in those salt-cured foods,
Okay.
smoked, or pickled foods.
Mm.
So think of things like your deli meats,
Oh,
bacon, sauerkraut,
okay.
things like that.
Interesting.
Yeah, those have been linked to a higher risk of stomach cancer.
So maybe it's time to swap out the pickles for an apple.
Exactly.
Yeah.
And on the flip side,
Uh-huh.
a diet rich in fruits and vegetables
So,
seems to offer some protection.
okay. So it's
Yeah,
really
It's all about balance.
all about balance.
Yeah.
And of course, we can't forget about the
Yeah, the usual suspects.
usual suspects of smoking
Right.
and drinking too much alcohol.
Smoking and excessive alcohol,
Yes.
they significantly increase the risk of many cancers,
Makes sense.
including stomach cancer.
Okay. So we've talked about salty foods. What about portion sizes?
Portion sizes, yeah.
Does obesity play into this?
It does. Unfortunately, being overweight or obese,
Right.
especially if you carry that extra weight in your upper stomach area,
Okay.
that does increase your risk.
Interesting.
Yeah, we're not exactly sure why,
Okay.
but some studies suggest it could be linked to chronic inflammation
Oh, okay.
and hormonal changes that are associated with obesity.
So keeping those extra pounds off
Yes,
is good for our waistlines
absolutely.
and on our stomachs.
Exactly.
Right. Well, that makes sense.
Yeah,
So we've talked about who's at risk.
right.
What about the warning signs?
Warning signs, yeah.
What symptoms?
That's where it gets a little tricky.
Okay.
Early stage stomach cancer is often a master of disguise.
Oh, no.
Yeah,
It moves
they may
on.
not have any noticeable symptoms at all, or
Yeah.
the symptoms it does have can be very easily mistaken for something much less serious, like indigestion
Right.
or a stomach bug.
Just like a silent saboteur.
Yeah, it can be very sneaky.
Oh, that's worrisome.
It is, yeah.
So what are some of the things that we should be looking out for?
Right.
Even if they seem minor?
Well, I think one of the most common symptoms
Okay.
is persistent stomach pain or discomfort.
Okay.
Now, we're not just talking about a little heartburn after a spicy meal,
Right.
but a pain that hangs around
Okay.
and doesn't go away.
Got it.
Another red flag is nausea and vomiting,
Okay.
especially if there's blood present.
Okay, that definitely sounds like
Avoid
a
it.
sign that something's wrong.
That's a big one.
Okay, and what about...
Also, watch for any unintended weight loss.
Okay.
If you're suddenly dropping pounds without
Mhm.
trying,
Okay.
that's always a cause for concern
Okay.
and warrants a trip to the doctor.
Okay, what?
Difficulty swallowing,
Oh.
also known as dysphagia,
Okay.
is another warning sign.
Wow.
That's where it can feel like food is getting stuck in your throat or chest.
That would be pretty terrifying.
Yeah, it's not a good feeling.
Okay, so difficulty swallowing, unintended weight loss,
Mm-hmm.
nausea, vomiting, stomach pain.
Right.
What else?
Keep an eye out for a loss of appetite.
Oh, okay.
If you're normally a foodie but suddenly find yourself uninterested in eating,
Yeah.
even your favorite foods,
Right.
that's a red flag.
Okay, so it's like your stomach is staging a hunger strike.
Exactly.
Interesting.
Other signs include bloating,
Yeah.
feeling full very quickly,
Uh-huh.
even after eating just a little bit,
Okay.
and unexplained fatigue.
Okay.
And then another one is anemia.
Okay.
So this can cause fatigue and pale skin.
Right.
Stomach cancer can sometimes cause internal bleeding,
Oh, wow.
which can lead to anemia.
So there are a lot of things to be aware of.
There are, yeah.
It seems like stomach cancer is a bit of a ninja.
It is very much so.
Silent and sneaky.
Silent and sneaky.
But you keep emphasizing early detection.
Right?
Why is that so crucial?
Early detection is so important because it really increases your chances
Okay.
of successful treatment.
Okay.
It's like catching the enemy before they've had a chance to build a fortress.
Yeah, I like that.
You know, and the problem is,
Got
as
it.
we've discussed,
Yeah.
a lot of these symptoms
Right.
mimic other less serious conditions.
Right.
And this often leads to delays in diagnosis.
Oh, wow.
And by the time it's discovered,
Yeah.
it may have spread,
All right.
making treatment more challenging.
So knowledge is power in this case.
Absolutely.
We really need to be our own health advocates
Yes.
and push for answers.
You got it.
Okay, so how do we go about actually detecting it early?
Detecting it early, yeah.
What tools do doctors use to investigate?
Well, one of the gold standard methods for detecting stomach cancer is an endoscopy.
Right.
Specifically an upper endoscopy, also known as a gastroscopy.
Endoscopy.
Yeah.
That sounds a little...
It's not as scary as it sounds. It's
Okay.
basically like, imagine a tiny submarine
Okay.
equipped with a high-powered light
Uh-huh.
navigating the terrain of your stomach.
Okay, that's a much better visual than what I was picturing.
Essentially, the doctor inserts a thin, flexible tube
Okay.
with a tiny camera on the end down your throat and into your stomach.
So they get a first-hand look
Exactly.
what's going on in there.
A first-hand look, yeah.
Joseph.
And if they see anything concerning,
Uh-huh.
they can take a biopsy,
Okay.
which is a small tissue sample,
Right.
to examine under a microscope
So it's almost like
to determine if cancer cells are present.
a miniature detective mission
Yes.
inside your stomach.
Exactly.
Are there other ways
Yeah, there are other methods as well.
that doctors use to detect stomach cancer?
Imaging tests are also commonly used,
Okay.
such as CT scans and ultrasounds.
Okay.
And these create detailed images
Okay.
of your stomach and surrounding areas, allowing doctors to look for any unusual growths or masses.
Right. So it's like putting together a puzzle using different clues
Yes.
to get the full picture.
Piecing it all together.
Are there any other tests that they would do for early detection?
Blood tests can also be helpful.
Okay.
They can detect anemia, which, as we mentioned, can be caused by bleeding from a tumor.
Right.
And they can also identify elevated levels of certain proteins that
Okay.
are sometimes associated with stomach cancer.
Interesting. So there's a lot that they
Yeah.
can look for in the blood.
Yeah.
Okay.
And of course, we can't forget about screening for H. pylori.
Right.
Since chronic infection with that bacteria is such a major risk factor,
Right.
it's essential to get tested and treated if you have any risk factors.
So really important to address. So,
Absolutely.
yeah. Treating that infection could prevent cancer from developing.
Right. So that makes perfect sense.
Yeah.
So we've covered a lot.
We have. Yeah.
Risk factors,
Yeah.
these sneaky symptoms.
Early detection methods. Is there anything else that we can do
Yeah.
to protect ourselves
That's a great question.
from stomach cancer?
Yeah.
Or is it just kind of...
While we can't completely eliminate the risk,
What?
there are definitely steps we can take to significantly reduce our chances.
All right, let's hear them.
Okay.
What
A lot of it comes down to
Better.
those healthy lifestyle choices we talked about.
Okay, let's recap those.
So if you smoke,
Yeah.
quitting is the single most important thing you can do.
Okay.
Not just for your stomach health,
Okay.
but for your overall well-being.
I know it's not easy,
It's not.
but there are so many resources available
There are, yeah.
to help people.
Absolutely.
It's never too late to pick the habit.
Never too late, yeah.
Okay, so,
Quit smoking. And if you drink alcohol,
okay,
do so in moderation.
right.
Excessive alcohol consumption is linked to an increased risk of several types of cancer,
Yeah.
stomach cancer included.
So it's okay to have a glass of wine with dinner,
Yeah, absolutely.
but maybe skip the
Your
nightly
best.
six-pack.
Exactly.
Okay, good advice.
Diet also plays a huge role
Okay,
in stomach health.
okay,
So focus on eating a balanced diet,
okay,
rich in fruits, vegetables, and whole grains.
okay.
These foods are packed with antioxidants and nutrients that can help protect your cells
Got it.
from damage.
And I've heard that colorful fruits and veggies
Yes.
are especially good for you.
The different colors
Okay.
in fruits and vegetables
Uh-huh.
often reflect the presence of different types of antioxidants.
Oh, interesting.
So aiming for a rainbow of colors on your
Okay.
plate can help ensure you're getting a wide variety of protective nutrients.
So ditch the beige dye
It's the beige, yes.
and embrace the rainbow.
Embrace the rainbow.
Okay,
Yeah.
I like that.
And don't forget about limiting processed foods,
Right.
salty snacks, and red meat.
Okay.
These foods have been linked to an increased risk
Yeah.
of stomach cancer.
So it's all about making those healthy swaps. Instead of reaching for a bag of chips,
Right.
grab a handful of nuts or some cut-up veggies.
Exactly.
Got it.
Yeah. Okay.
And lastly, maintaining a healthy weight
Okay.
is essential
Okay.
for overall health,
Right.
including stomach health.
Okay.
We already talked about
Yeah.
how obesity increases the risk.
Yeah.
So keeping those extra pounds off is a good way to protect your stomach.
So find an activity you enjoy,
Exactly.
whether it's walking, swimming, dancing, or something else,
Whatever it is.
and make it a